Okay, so we will begin our X Spaces in 5, 4, 3, 2, 1. So, good day, good afternoon to all of you guys, wherever you are in the world. So, this is yours truly, Jeff Caceres, also known as Nomad Fury, and I'm your host for today's X Spaces right here on the Zenix Launcher. So, thank you so much, Zenix Launcher, for onboarding me as your host for today's X Spaces. So our special guest for today's X Spaces is no other than the founder and CEO of Medicalveda. So please welcome Mr. Amir Neghabian.
Yes, hi. First of all, thank you for having me here. It's very exciting to be here, especially with your curious community. So many nice questions I noticed came past a few hours. I'm here to address any question, please. And I'm very much excited to be with you guys, and trying to learn more from the question that you're raising. And I'm sure that your question will be so useful to us that we can actually have a good progress toward this exciting concept that we are actually building. And I'm all here to hear your questions, your feedback about your project, and anything that you like to ask me, please.
Okay, so it's great to meet you, by the way, Amir. Okay, and also I would like to say hello to all of our listeners here who are tuning into our X Spaces right now with Medicalveda. So, guys, if you are really interested to learn more about what Medicalveda has in store for us, especially when it comes to the concept of blockchain and AI into the medical industry, so this is your opportunity, guys, to learn more coming from our speaker, Mr. Amir Neghabian. Okay, so are we all set right now, Amir?
Yes, you're all set. Please.
Okay. All right. So first things first. Before you guys have for Medicalveda, so let's try to stroll back in time, shall we? How did you got started and getting interested into the crypto and blockchain space, and what made you guys motivated in forming Medicalveda?
Very good question. I actually was a business owner back in Australia for many years, and my primary activity was in telecommunication in the first place. And till actually about 6 years ago, which we have an exit from our being actually a service provider in Australia, running my own business for about 15 years. Then I was actually thinking about more of ecosystem back in Australia, and also I was actually frequently having a travel to Canada. There were a few concepts which was actually making me very interested at that time was, just how we can actually come up with a platform to communicate between the patient and the healthcare provider. That was the first thing that was actually came to my mind. There were a few good samples running in Australia at that time, which was actually somehow was a point of interaction. It was not like more of like an EMR, but it was actually a point of communicator between these two parties. How they actually they can reach to one to another easier in terms of being having an obstacle back in healthcare, which was kind of very similar here in Australia, Canada, and also UK. That we were primarily studying about the ecosystem. So then it was back in 2000. It was back 5 years ago exactly that I was attending few conference event, and I get to know the technology of blockchain. It was something that it was fascinating me as the fact that, okay, this can actually be a solution to the problem that we have been identified at the earliest stage. And since then, I was writing the white paper. We were forming a team. We were actually conducting our research. We came to this far with a few solutions, either from B2B point of view or B2C point of view, as how the AI, the Web3, the blockchains can come up as a good solution, as a good fit with the health and fitness together within this ecosystem, and how we can actually gather all this information to provide some generic productive AI for this ecosystem, that it actually comes up and uses its own data. And that's actually the journey that it drives me till this point of time.
Oh wow, that's great to hear from you, Amir. On how did you got started into this space, especially on integrating, the medical stuff into the blockchain and AI, and how you really formed the Medicalveda. So thank you so much for that, Amir. And my next question for you is, what is currently your mission and vision for Medicalveda?
Okay, good question. Look, this particular field, it's something that we learned that it requires more of research. Anything comes with the health, fitness. It's definitely a very sensitive area to just absorb and to just be active on. So. We did actually our initial prototype setup on building a PHR, a patient health record, which that was also something that I was actually the health ministry of back in Australia. They were introducing that a while ago, but we saw that as to be a complete failure. For the fact that the security, the transparency, and also the encouragement from the community for the user was lacking. So we were seeing that it didn't really actually provide a very good response. And then we were thinking, okay, if this is the case, why we don't actually come and bring some spice to it, some some integration and adaptations of the technology. So this portal will just not be a repository to store your medical records only, but also communicate back to you. It would be a feed that you can actually somehow use and integrate AI to it to just come up and provide you, the sort of insight that it's more personalized. It's more actually coming to one person need. Plus, the exchange of information, the records that it could be distributed from one party to another party of this ecosystem. And also the fact that if it goes on to the ledger, and how that actually can come up and provide the security and ease of mind to the holders of these informations, as how to store it, how to provide the digital key to the ecosystem key player, and how that can be actually distributed among these parties. Either is a research company, either is your general practitioner, either is the university, or is simply the health minister that they want actually to conduct research. Like in the time of COVID, we'll see how sensitive and how important is that to get actually through this information that conduct the research for vaccination, find the solutions. And we see that, in the pandemic time especially, that can help the society in a great benefit.
Oh wow! So that's great information, on the mission and the vision that you have for Medicalveda. So thank you very much for that, Amir. Now, my next question for you is: I have encountered a lot of projects in which they have combined, the medical technology and blockchain and AI. So, could you elaborate more on what makes you guys stand out from the rest?
Well, yes, you're right. There are lots of projects, and they are very interesting in the space of decentralized science. We actually come up and see each of them every day. It's a fact that we don't want, because yes, we like actually to differentiate ourselves, but again, we like actually to be open source to provide this ecosystem. Time to time, we actually getting to the partnership with with the one that they're doing a research. They have a DAO. They actually are providing a decentralized science solution to share this experience, this knowledge, this information all together. saying that apparently the primary application that Medicalveda is working is more onto the fitness. And we are trying to actually launch our very first product, which called Vitalveda, is actually a sub product of Medicalveda, and that more to work on the fitness of each individual using AI as how to track your fitness, how to monitor your fitness exercise, and also providing the best package based off your needs. So it's all about the data that is driven to this application, come up and getting analyzed and providing generic solutions to each person.
Okay, so that's wonderful to hear from you, Amir, on what makes you guys stand out from the other projects, who are also into blockchain and AI that, was integrated into the medical technology. Okay, now I wanted to read some of the questions here coming from our community. So I want to read one of these coming from Leonie, and I quote, could you elaborate more on how Medicalveda's decentralized platform ensures the security and privacy of patient health records, and how does it compare to traditional electronic health record systems?
Of course, that actually is the main objective of us actually being in the market, because once you start, the fact the element of the security was what it was in our mind. I remember at the beginning of 2019 that we were actually trying to come up and do the research. We were having some news about of some insurance, medical insurance getting hacked with all the information. And first of all, we were thinking, okay, why this thing is so much due to the targets of being disclosed, and what exactly we can do. And introducing a blockchain technology as a back end, as some sort of decentralized solution, which it will actually help you to encrypt this information in a way that anyone actually wants to access that, they need actually to have a private key for it. And it's not actually going to be storing in one place as a centralized server, but rather it's going to be distributed among the own true owners of this medical record. So then we, the very first technology that we were researching and how we can do that and how we can actually come up, it was using the IPFS to somehow, storing a part of metadata of the, the general records, as a sense that, okay, that can come up as being as identifier. So for example, if I am actually Amir Neghabian, I got the date of birth, I got the very much general, information that actually can come up and be disclosed, but the rest will be encrypted. And whoever wants to access that, then I'm actually the key holders of that repository. I have to give a permission, and that works based off the permission base of data holders of that records.
Okay, so yes, thank you so much for that. All right, and let's proceed now to the next question. So, coming from Emily Louise Dubois, and I quote, how does Medicalveda facilitate peer-to-peer lending in the healthcare sector, and what safeguards are in place to ensure the security of these transactions?
Sure. So if I get the questions, how do you actually facilitate the peer-to-peer in decentralized environment? Is that correct?
Yes, exactly.
Okay. Look, the fact is that the transactions that is actually happening in the internal ecosystem and what actually will be the media to provide this peer-to-peer exchange of the value. Let's say that, you got the value of your information that actually will be encrypted. Either, it comes as an NFT for what you have actually been in the holder. So saying that NFT here is a kind of utility NFT, which will help you actually to have a peer-to-peer exchange in terms of the value of what actually you're holding. And saying that we are actually in the environment that things it's been encrypted. We are in the blockchains, and how we are actually storing the data, how we are distributing that, and either it's coming as the exchange of the value within what we have actually been stored in that particular things that actually comes up as the protocol that we are actually getting building at the back end and the ecosystem of our solution.
Okay, so that's great to hear. Hopefully this answers your question, Eva Maria, right here via Telegram. So thank you so much for that. Now, next question coming from Lucas Martinson, and I quote, "Can you explain how Medicalveda's platform enables global access to patient data while maintaining patient consent and privacy?"
Sure. That also again comes to the same thing. We were actually talking about having this permission on how we can actually distributing data, how we can actually basically it's how the technical architectures is working behind the concept, and it's just the vision that we have here, the main missions that we are actually pursuing with this place is to having a big marketplace for the medical records data. Let's say that we are talking about something in the global scale, and how we can actually distribute these things in the forms of that whoever medical research entities or any medical associations are searching for certain information that can actually comes to them as as efficient as possible, and how that actually can be distributed with the consent with the permissions of the true holders of this information.
All right, so hopefully this answers your question, Eva Maria. Okay. Now I'm going to entertain two more questions right here in Telegram. Okay. Oh, sorry, I stand corrected. It's from Lucas Martinson's question. Okay, thank you so much for that. Now, the next one, of course, coming from Victor of Crypto Starter Community, and I quote, "How does Medicalveda plan to address the challenges associated with integrating blockchain technology with existing healthcare systems?"
Yes, I mean, we are thinking of format interoperabilities, and how actually these will actually and obstacles that saying that how this information among these stakeholders will communicate, and the fact that thinking as one protocol, one general actually things that it will actually solve these problems, because this is actually one of the very major problems within the healthcare sector, and it's something that it will actually stays for a long time, that these EMRs and the EHRs as how they can actually come and interact together, and how they can just share data and files within each other. However, once you come up and define a certain protocol, healthcare protocol, that it become like some sort of industry benchmark in a sense that the file distributions will actually be easier. It will be actually aligned with other people also that they are being in this field, and having exactly the same protocol as being actually something unique standard, let's say, to be defined within the healthcare. So then that will actually is the main objective of the Medicalveda, to come up and find out, work more onto this solution as how we can actually come up with this standard. Saying that, obviously, this been actually one of our biggest challenge to, as I can actually admit, as things, especially in this sector, was not that actually what we were actually expecting to be. So that's why we shift ourselves more to be very much a patient generic sort of platform, and drive the patients to come up and stores the information. We can encrypt the information, and we can actually come up with this defined standard and protocol to be able to do something good with this ecosystem, with the healthcare industry, and whoever actually can get benefit from that.
Okay, so hopefully this answers your question coming from Victor of the Crypto Starter community. Now, I want to entertain questions here coming from the committee here in X Spaces. So I see that there are some who have raised their hands. So I think we should start first with Victor. So could you enable your mic, please?
Hello, sir. Can you hear me?
Yes, we can hear you.
Yeah, thank you for giving me opportunity. Can I ask my question?
Yes, sure. Please go ahead.
Yeah, my question is, what are the main features and benefits of the MDEVA token, and how does it facilitate staking and super staking?
Sure. If I'm actually get it right, you're talking about our standard feature. Is that right?
Victor, could you turn on your mic?
I'm sorry, because
Yes,
okay.
I repeat my question.
Let me actually come up as the standard features, and also what we are trying to be built. The primary attention is actually is a product that we call it MVEDA Health Portal, and the MVEDA token actually is the media that is working within this health portal. So basically, what is actually the utility of the MVEDA token is that it will actually come up as a medium to be able to let people to come up and use the portal first, store the data, and they have actually, let's say, a personal portal that everyone can actually go there, get the insight that they were looking for. Either it's for nutrition, it's for health benefit, it's for the early diagnostics of a symptom. It's more insight that they get for their health, for their patient. And answering your question is that, okay, what exactly the MVEDA token does is, after building this health portal, we are hoping that all these stakeholders of the informations that rotating and getting actually stored there would come up and create a hyperledger private permission blockchains ecosystems to be able to share their data, the health information within the ecosystem. And then once actually you do that, you will be able to get a benefit from whoever actually is interested to get access to your information. Basically, the MVEDA token is working into this marketplace of the health information versus the parties that actually are interested to get these informations in hand for any reasons, for let's say for any things that they would like to conduct research pharmaceuticals, universities, governments, or health insurance to be. And the incentive will actually goes to whoever will register to this portal, having the MVEDA token, and then receiving the MVEDA as a benefit to the information that they're exchanging with the ecosystem's parties.
I got my answer. Thank you very much.
Okay, so hopefully that answers your question, Victor. Thank you. All right. I think the next one, Bullish. Could you turn on your mic?
Hello, can you hear me?
Yes, please.
Yes, loud and clear.
Okay.
Loud and clear.
How does Medicalveda address the issue of medical misinformation and ensure the dissemination of evidence-based information?
Okay. I'm sorry, actually, I didn't get the question right, but maybe if I just repeat the question. So you're talking more as a security? Is that right?
No. I repeat my question. How does Medicalveda address the issue of medical misinformation and ensure the dissemination of evidence-based information?
Sure. So, look, it's a fact that it was something that we were actually thinking about this as, coming and address it in a sense that's more of the security, let's say. But if something actually comes as, because, you got an AI as the back-end engine, obviously, the fact is that all the informations and all the output generating by, this AI has to come up and getting validated. So obviously, in the first place, it's the type of information that it's very much sensitive to come up as a source. And how we were actually thinking about that is that we actually were getting a partnership with a group of medical practitioners, either they are specialists, family physicians, general practitioners, or whoever actually are conducting research on this field, and then authenticating this sort of, their qualifications, the type of information that actually will come up here as a feed. The entity that we were actually getting a partnership back in Australia were called the AusDoc group, and there were actually associations of medical doctors that we were actually kind of getting this incentive to them for the information that they actually were providing to this platform. So we were encouraging these people to come up, to bringing their research, to bringing their input, to monitoring all this, the information, the reports, the output that is being generated by our application. And this was actually a way to come up to the authority to say that, look, we are actually come up with this, with the quite meeting the standard, that all these things that have been generating from the back end has been validated. There is no misuse of any information, and we can actually come up and say that the quality and the assurance and everything has been met in the scale that we can actually satisfy the health authority that we are actually providing a reliable, relevant type of information to individual.
Okay. I have one more question. Can I ask?
Sure, please.
Okay. Ambassador plays a very important role in every project. So do you have an ambassador program? If yes, how can be one?
Ambassador program because yes, again, as I was explaining, like for example, the partnership that we formed, it was kind of sending an invite to whoever are within this particular field, whoever who can come up and actually provide more value to our ecosystems, because again, we are trying to be a point to bringing all this information in one place. Again, there are lots of parties to being an open source protocol, send an invite to different interested party within ecosystems, either to contribute, providing an insight, bringing their research, or sometimes they thinking, okay, these particular records can help them as how actually these informations can come up and provide something as a solution to the existing healthcare problems.
Okay, thank you.
Okay, so hopefully that answers your question, Bilish. So guys, since we have time limit and only have 11 more minutes to go, so we might have to entertain a few more questions. The next one is coming from JR. So could you turn on your mic, please? JR, hello.
All right, can you hear my question? So yeah, my question is about data privacy. So which region, different languages, can users use their platform who doesn't understand English? And also, are there any country restrictions to the usage of the platform?
I'm very sorry, actually, because the voice was a little bit, actually, the quality was not that good. If you could please repeat the question one more time.
Yeah,
I'm sorry about that.
In respect of the country restrictions, is your platform available in all countries?
Okay.
Or is it restricted to some parts?
Sure. Actually,
then also, I want to know about the language too barrier. Is it only English-speaking users, or does other languages make it to the platform?
Of course. Yes. Look, yes, I got the question right. Thank you. Initially, the objective for me was serving a global solution, especially for the environment, for from the regions that they are more actually in need of the data. And it could be actually somehow a platforms that it can actually share, distribute insight, information, data across the globe. So saying that, definitely, when it comes to the health, when it comes to well-being, there is no restriction in terms of territory, in terms of the country, and also the language that we actually using as what we actually having at the back end. Obviously, all the standard, everything will be in English to start, but saying that it is within our roadmap to make sure that this platform would be accessible for whoever they need to use, and expand our territories, introducing more language to it, especially to the area that we're thinking, okay, this solution definitely can come up to something very good to them. And it could actually serve to be as a very useful things to help and assist their healthcare ecosystem.
Yes, thank you so much, and success to the team.
Okay, Dan, thank you very much for that. So we have 8 more minutes to go. Now, I want to select the next one.
All right.
Let's say RX.
Hello, can I ask my question?
Let's start first with RX. Yes.
All right.
Hello,
my
sir,
question is, can you provide more details on the Medicalveda health portal and how it enables individuals to access and manage their health data securely and conveniently?
Of course, the VEDA health portal actually is one of the key standard products that we are working on. Basically, we finished the prototype, the designs, and the functionality and everything has been completed. If you also go into our white paper and also website, you will see more details of exactly how is that work. We drafted all, the back end engine, the algorithm, and the data flow, as how that peer-to-peer validating entities can come, and working on this hyperledger type of platforms that it will actually come up and work as let's say an internal permission blockchain system, which then after we done this and we were comfortable, as the platforms can come serve actually the need of the industry, and how we will actually integrate the AI engine to back end of this portal to be able to provide more useful insight based of each person need. But let's say that primary, the objective of us is to come up and define the technical architectures of how this portal it works, how we are storing the data and the data layer, because again, also we're explaining about the security, how we are storing the data storage, how the IPFS comes to help us, what information and data can be stored, what actually can be encrypted, and so forth. And then the peer-to-peer protocol that will be actually identified. And once you got actually this in hand, then our roadmap will actually come up and introduce more product which would be aligned with this portal to serve more needs for people who are actually in the ecosystem, that they want actually to have a better use of all this information and data.
RX, could you turn on your mic? Does this answer your question?
Yeah, exactly. Thank you very much, man. Thank you.
Yeah.
My question is, how does your platform handle the potential issues of liquidation and fragmentation across multi-chains? And what strategies are in place to maintain a balanced liquidity pool?
Sorry. Okay, so that's from... yes, I got the question. So first question, if I'm right, it was about the multi-chain. And then how we can actually provide the balance for the liquidity pool. That's actually it's on the very different agenda. Let's say that obviously, to maintaining the MVEDA value, yes, we actually require to have that collateral, the pair that will be associated with the value of the token. But saying that, it's the MVEDA actually work more as a utility token to be. So we got actually a definitions of how this token will actually be in the ecosystem, the income that will be generated via these circulations of the MVEDA token in this ecosystem, and the value that will be gained through the exchange of the data. And then when we are coming at the listing point of the fact and the trading of these things, obviously in long terms, we want to make sure that this liquidity pool, this income, and this value will be maintained. And how we want actually to make sure that we will be maintaining this is to providing a more kind of DeFi solution, in the fact that how the stakeholders will be able to come, hold their MVEDA, what benefit they will get from holding it, what's the benefit of actually using it in the ecosystem. And once the business are in the production and we start creating a revenue, how we can actually come up and maintain the circulation, in a sense that we identify a token burning, reduce the total supply, creating more demands, and on the other side, also creating more value. And asking about a multi-chain. Yes, we are always actually in the things that, okay, introducing MVEDA token in a different ecosystem, which there is a liquidity, there is a community, there is a users, and how we can actually bridge one to another, and what's the benefits each ecosystem will serve to MVEDA token.
Okay, so hopefully that, yes, continue.
All right. What are the potential future of this project in the next 5 to 10 years to come?
Very good question. The very interesting concept that I encourage the community to go and check is Medicalveda, as the very first application that is going to be launched on September this year. Medicalveda is a fitness social application. The reason that we actually comes with that one, because it's how critical and important it is to come up and to do some B2C type of solution to make sure that we drive the community, we create an engagement, we create attractions, and on the one side also we are accumulating the data that we require. So please follow us. Stay tuned for a new launch, which is coming very soon.